Hey folks, Blair from Nose Creek Sport Physiotherapy. So today we're going to talk about planking exercises. These are my favorite exercises because when your spine is healing, we want to work all the muscles around your spine without aggravating your back. And so you're going to get maximal muscle contraction without even moving your back. As you do these and they get easier, a lot of patients say, oh, they're kind of boring. Well, at that point, let us know if they're boring, because if they're boring, that means they're easier and we need to take you to the next level. So today we're going to talk about level 1 and level 2 planking exercises and the different positions that we can do them in. So let's get started, okay? So here's level 1. So on our stomach, we're going to put our hands together like we're praying. Our elbows are about the same width as our shoulders and just going to lift up. And our hips should be about the same height as our shoulders. So that would be considered level 1 off the knees. We're drawing our belly button up and in, and we're squeezing our cheeks. We're kind of tightening up our core and just continuing to breathe the whole time. Okay, so that's level 1. Once that becomes easy and it's comfortable, then we're going to go up to level 2. Level 2, we come up onto the toes, and we're going to hold there, just like that. Okay, and you're going to quiver and shake. That's normal. The quivering and shaking is muscles turning on and muscles turning off. So don't worry about that. Okay. So the side plank, what we do is we get to 90 degrees with the knees. We put our forearm here. We're just going to lift up our hips. Okay, and we're going to rotate forward just a little bit, and then you'll get a nice contraction right in here. This contraction you're feeling just above your belt line, kind of on that oblique area, is your oblique muscles, okay? And then back down. Now, people always say, like, how long do you hold it for? So you want to start off with 10-second holds, and then as you're getting better, try to work your way up to a 30-second hold, okay? But you don't need to do like 1-minute holds. In fact, it's probably better to do 2 sets of 30-second holds than to do a 1-minute hold, just so that you don't overload those abdominal muscles, okay? And then of course, we just did the left side, then we do the same thing on the right side. The level 2 for the side plank is we now straighten the legs out, okay? Now we're gonna come up and we're gonna pivot off the side of our foot, and we're gonna rotate again forward just a little bit. And we'll get a massive contraction right in here, again, of those oblique muscles, okay? And again, you're gonna hold that position for 10 to 30 seconds, depending on how you're feeling, okay? And again, we do the same thing on the right side. The last position is the bridge position. That's where we're on the back. We're gonna put our hands up for level 1. We're just gonna lift your butt up, okay? Or you can have your arms down if you want. But ideally for a younger patient, anybody sort of 50 and below, we'd say try to line up your shoulders, hips, and knees, okay? As we get older, our spine doesn't like to go into hyperextension. Some of my older clients in their 60s, 70s, 80s, I just tell them to lift up so they're like maybe 3 inches off the floor. So it's okay if their bum is a little bit lower than their knees, okay? Because we don't want to hyperextend their spine, as that might be giving them symptoms, okay? So that's called level 1. When that gets easy, level 2, and this is what I do at home actually as part of my fitness routine, I just straighten one leg out, okay? You really want to squeeze the cheek, tighten the tummy, hold there, and you can even do marching, okay? So you can do kind of 10 to 15-second holds in that position, and that'll really work all your core, your glute, your hamstring, everything gets work in that position. Now, when you go in that position, what your body will want to do is you're going to lift up. If you're weak, it'll do this. So if you're doing that, you're not quite ready for this yet. But if you can comfortably hold there, then you're probably good to start doing those, okay? So just watch the position of that pelvis. And that's level 2 planking on the back. Now, while we're here, I'm just going to show you one more. This is called an oblique reach. So your obliques run at a 45-degree angle from your rib cage down to your inguinal canal down here, basically top of your thigh, bottom of your abdomen. To really focus on those, we can put one hand just above our pelvis or our hip there, our glute. We're going to draw our belly button up and in. We're going to slowly reach up just on the outside of that knee, hold there for 8 to 10 seconds, and then down slow. I'd like to see that everybody does 5 here, okay? And then we do 5 to the back of the hip bone here. When we're reaching to the knee, we're hitting more of the vertically orientated fibers. When we're reaching to the hip, we're hitting more of the horizontally orientated fibers. Because on average, they go at about a 45-degree angle, but they're not all in the same angle. They kind of splay out like a fan. So that way you're working different parts of those obliques. So here we are, 90 degrees. Draw the belly button up and in, tuck the chin, reach up, hold, 10 seconds, and then down slow. 5 to the knee, and again, 5 to the back of the hip, and then down. I guarantee you that'll fatigue your abdominals, and if you keep that up, you're gonna have legendary abdominals. All right, take care guys, and less back pain, which is even more important. All right, talk soon, bye-bye.